I'm Dr. Elona with Inspire Smiles. In this video, we will discuss symptoms of TMD or Temporomandibular Joint disorder. And again, it's a disorder. TMJ is just the name for the joint. The disorder is the name for anything not working within the system of teeth, ligaments, muscles, joint, and airway being out of balance. And we also have an internal component, which is central nervous system mediated, and also kind of more of the inner interpretation of what one could consider stress, because we all have stress in our lives, but we don't all have a temporomandibular joint disorder, right? So it's also like processing stress and also activating sympathetic nervous system to a point of it being completely out of control. I specialize in treating that condition non-invasively in integrative manner, where we take allopathic methods that we have in dentistry, combine them with integrative medicine methods, and have a great resolution for a lot of conditions that cause those symptoms. One of the things that they feel, or you might feel, is your jaw not opening wide enough. So that's one where you can't open. You wake up and it feels like it's locked. When you chew, you also have just pain upon chewing and pain on teeth. Having muscle pain in the muscles of the head and neck or face. Also tension headaches around the temples. Headaches here, which is the other part of the temporalis muscle. Frontal headaches, which is the forehead. And migraines, that would be kind of on the spectrum of symptoms, that would be the most extreme. Also feeling less mentally focused, emotionally imbalanced. Let's say you got a filling done and the bite, after the numbness wore off, the bite doesn't feel right after, and you have to return to your dentist to have the bite adjusted. So that's going to be part of actually, TMD disorder potentially, or restoration's not lasting. Like you had fillings done, they break down, they need to be replaced. A crown is being placed, also very, very common. The filling gets placed, doesn't feel right, bite gets adjusted, doesn't feel right, then something breaks, cracks, or the filling needs to be replaced. Then the crown is placed, the crown doesn't feel right, the bite needs to be adjusted, the tooth starts to hurt, then the root canal gets done, and sometimes it progresses to the point of the root fracture. Root is fractured, tooth is removed, and then the implant is placed. So if you've ever experienced that progression from like a filling all the way to an implant, or all the way to a crown and the root canal, that's usually not normal, and it's usually not due to extensive decay. It's usually a part of actually bite stress not being evenly distributed. If you're getting a lot of dental work done and it's continual, not stopping, it seems like every time you go to a dentist you need something done, it could be related to TMJ disorder. Physically not feeling at your optimal best, kind of tired, and also needing to rest a lot. So those are all the symptoms of TMJ disorder, and I specialize in correctly diagnosing it and taking care of the symptoms in the least kind of invasive way, more conservatively, more protective, long-term stable.